Welcome to Anuban Pibelmet School. Hello again. I am your teacher Daisy and it is health time. Our topic for today is the National Health Regulation and Guidance for Good Practices. Introduction. We have three international health policy programs in Thailand. The first one is the National Health Act BE 2550. Under this is the stress on multi-sectoral participation, founded the National Health Commission Office or NHCO. Number 2, roles of NHCO. Number 1, steering towards well-being and humanized health system, drafting the National Health Charter, organizing the National Health Assembly, promoting community and multi-sectoral participation in policy development, and performing health impact assessment. The NHCO's interests in international experience in order to strengthen its role as a steward. Example of national ID card in Thailand. This is the ID card in Thailand. How to treat the health of a person. Look at the 5. The holistic. It is included the intellectual, the physical, the spiritual, and the emotional. Factors of making HIAP possible in Thailand. Number 1. Broaden definition of health. Thailand redefines health as well-being, covering physical, mental, spiritual, and social aspects. Number 2, legitimacy. National Health Act 2007 is a law specifying a multi-sectoral mechanism and tools such as NHA that builds HIAP. 3. Responsible organization. National Health Commission Office under the Office of Prime Minister plays as a policy facilitator. And the last is the participation. Thailand calls triangle that moves the mountain. Government, academia, and civil society. Here is the Prime Minister, the Minister of Public Health, the Ministry of Public Health, and under this is the Permanent Secretary General. There are 3 clusters under this. Cluster of Medical Services Development. Under this is the Department of Medical Services, Department of Mental Health, Department of Thai Traditional and Alternative Medicine Development. Cluster of Public Health Services Support. Department of Medical Science, Department of Health Services Support, and the Thai Food and Drug Administrator or Thai FDA. And the last one is the Cluster of Public Health Development. Department of Disease Control and Department of Health. Food Safety Law and Regulation. The Food Act BE 2522 or 1979 is the current mandatory food safety standard and consumer protection in Thailand. Next is Minister of Public Health is in charge to promulgate all regulation called notification pursuant to the Food Act. Number 3, notification covers all aspects such as standard and quality, packaging, labeling, storage, distribution, and importation. Okay, this is the draft, the notification of MOPH entitled Food Additives. Ministry of Public Health has reviewed the existing provision of food additives labeling and concluded it should be updated. The notification of MOPH number 281-BE 2547 of 2004 entitled Food Additives had been amended as follows. The labeling of food additives should have text in Thai language details as follow. Number 1, a name of food additives with marked by the word food additives. Number 2, a food serial number. Number 3, name and address of manufacturer or packer. And number 4, lot number. And number 5, the net contents system international units. This is the importance of the food that we buy in the store or in the mall. You should know or read the labeling of food additives. Okay? Because in our public health or national health, you need to follow this. It is very important. So now I will do a video to watch that is about the pandemic that happened in our country, in Thailand. As of now, this is the important to watch. Okay? This is sharing COVID-19
It's so much easier to
experience.
fight an epidemic like COVID-19 when you have a strong underlying health system. Thailand has spent 40 years committing itself to and investing in its public health infrastructure. This is really where the rubber hits the road in a pandemic.
Sharing COVID-19 experiences, the Thailand response.
Thailand has experienced several outbreaks of very large scale, starting from SARS back in 2003. Those taught us lessons, make us prepare for the big pandemic. We started our implementation of WHO IHR capacity in 2006-2007 and also improve our public health emergency management. In early March, we start to see a rapid increasing of local transmission. The number of new cases gradually reduced through April and May.
This is something that WHO emphasizes to countries again and again. The need to be able to identify cases, isolate and treat them, and quarantine and trace contacts is so important.
คิดก็ตอนแรกก็ไม่ได้คิดอะไรเท่าไหร่แต่พอรู้ว่ามันรุนแรงก็เริ่มตกใจนะคะเริ่มตกใจกันมากเลยนะคะเราทำอย่างไรที่จะช่วยชุมชนเรานะคะโดยเริ่มต้นจากในบ้านเราก่อน
The village health volunteers are ordinary people who devoted themselves to take care of their friends or family within their village. The strength of the village health volunteers has contributed significantly for the Thai government to keep things under control.
จะมีเชื้อโรคไหมอะไรอย่างนี้ครับผมกักตัวเสร็จแล้วผมก็โทรปรึกษาตลอดปรึกษาหมอตลอดครับผมถ้าว่าอาการอย่างนั้นอย่างนี้ปวดเมื่อยกล้ามตัวอะไรอย่างนี้
ก่อนหน้านี้มีเพื่อนเป็นอสตที่โรงพยาบาลเขาชักชวนให้มาเป็นอสตแล้วก็อยู่ไปอยู่มาก็เขาก็ไปเยี่ยมบ้านตามเข้าไปทุกวันก็สนใจในด้านนี้ก็เพราะว่าเราก็จะได้มีความรู้แล้วก็มีสุขภาพที่ดี แล้วก็ชาวเมียนมาด้วยกันจะได้มีสุขภาพที่ดีคิดอย่างนี้ก็เลยมาเป็นอสตค่ะ
The village health volunteers and the migrant health volunteers, they are really the eyes and ears of the health system in the community. I think it's really this trust between the community and the public health system. It's doctors, it's nurses, it's allied health professionals, and it's village volunteers that makes this whole system run so effectively.
I think one of the very good reasons that we can manage COVID-19 very well was that if you look at Thai cultures, whenever we have crisis, the Thai will unite.
That is a video from the World Health Organization. So, I hope you learn a lot in this video. Okay, thank you and see you on the next lesson. Stay at home and be safe.